Well, thank you very much. That was really a terrific speech, and I do apologize for butchering your current employer.
People butcher Washington, D.C. all the time.
So I do want to correct that. Dr. Ritchie is Chief Clinical Officer for the Department of Mental Health right here in Washington, D.C. And hopefully that sentence about dog poop and me in the same one wasn't in response to that. But I think we have enough time for a couple questions, so why don't we start here?
Hi, my name is Jackie Kammer. Dr. Ritchie, this is, I guess, more specifically for you. So in January, there was a ban lifted on women in combat in the military, and that was one of the main reasons that women were not required to register for the selective service. Now that that has been lifted, there actually is a bill making its way through Congress, which would require women 18 to 26 to sign up for the selective service. And I was curious if you had any thoughts on the psychological effects that might put on women in that age range.
Yeah, let me say, first of all, that women, as you all know, I believe, but I'll just state it for the record, women have been in combat for a long time. I wear 3 different combat badges from Somalia and Iraq. I think in some ways it's simply a recognition of what's already there, but it does open up certain military occupational specialties to women, such as engineers and infantry, MOSs. I don't actually know what the fate of that particular bill will be or what the psychological effects would be. So I'm hesitant to speak to that. It's an interesting question, though, and I'll keep it in mind.
Sure, thank you.
Lucy Popova, University of California, San Francisco. Great presentations. And listening to Colonel Hutchinson, if I were Miss Green, I would seriously consider joining the Army. But what I didn't hear mention is tobacco in the Army. And I know when recruits go through basic training, they cannot use tobacco, which is great. But then once they're actually in the military, tobacco use grows really high. And when they come back, they continue using it. And I just wanted to hear your comment on that. And what's the Army doing with that?
Good. That's a great question. The one study shows that those who've been to combat, their tobacco use is higher. But those who have not, the tobacco use in the 18 to 24-year-olds is about the same as the civilian population. So it's the combat exposure, and it's not just smoking, but it's the dip and all, that is still something that is actively worked on trying to get people to stop.
I think part of that is when you're being shot at every day, or you don't know whether the next drive across town you're going to be alive or have your legs at the other end. It's kind of hard to worry about cigarette smoking. But one of the real difficult areas for the military is when they're coming off of active duty. And I think there's a potential for a lot more to include tobacco cessation there.
And I would just add on that as well that the Department of Defense and Veterans Health Administration have combined on the medical front with a clinical practice guideline in managing it in the medical system. And there's been a lot of work in improving the environmental issues that predispose to tobacco use. Discounts at the post-exchange have been reduced dramatically. They haven't gone away completely, but they have been reduced dramatically. There's been much more of a social campaign, and I think, as already been mentioned, tobacco use clearly is more prevalent while deployed, and we've made great strides actually in garrison or at home.
And just to echo off of that, as far as the military commissary system, alcohol is cheaper, and it used to be much cheaper than it is, but that price has also been raised in the same attempt to try and decrease the easy access to alcohol.
There's a question for Elspeth. In the civilian mental health system, we often find that young adults are hesitant to go to adult group treatment or any kind of a group setting that has much older adults in there. They report that they aren't comfortable. They're the only one in the room who's under age 30, et cetera. And I know that the military is predominantly made up of young adults, but I wondered when we get to the Veterans Administration hospitals, if you encounter any of the same issues where the individuals who are accessing their services there tend to be older, and if that's any kind of a disincentive for the young adults.
Great question, and one I could talk about for an hour, so I think we got about 2 minutes. First of all, in the military, we do use group therapy quite a bit, and often the soldiers really like it because it does have a chance for them to talk to each other. And soldiers, by and large, they don't want to seek help, but they're always willing to give help to their buddies. So if you can put in the framework of helping other soldiers. What is difficult is like when I have more senior non-commissioned officers, I wouldn't want to put them with the younger ones because they wouldn't want to reveal anything about themselves in front of the troops that they led. So we usually broke those troops apart. Now, the second part of the question about the VA, I don't speak for the VA. I'm not a VA employee, but I am on an IOM committee looking at how they deliver treatment. And there certainly are breakdowns at times between the Vietnam-era vets and the younger vets. Sometimes, though, they can be really helpful to each other. Again, the Vietnam vet saying, hey, don't go through what I did for 30 years, get help now. Other times, the younger vet can't quite relate to the older vet. So there's advantages and disadvantages to each.
Thank you.
We have time for one more question.
Catherine Heath with the Children's Bureau. I'm interested in talking about the social media and how that's changed the idea of being in the military and your connectedness back home, and any information that you have on that.
Are you addressing that to any of us?
Any of you guys?
Well, the military, and I can speak more for the Army than anyone else, goes through different campaigns. When I was young, of course, the Be All You Can Be campaign, and then the decision was made that with the individuals of Generation X, it's more likely to talk about the individual Army of One, and now we're in the campaign of Army Strong. The Army has a huge, all the military has a huge web presence. They know that this is where we get our young people from. So if they're not part of that presence, they're not going to attract people into the military. So using the military to recruit, using the media to recruit is a big factor. And now in the healthcare system, using it the next step where we have something called Relay Health, where they can email us questions or connect on a secure message board. That's the next generation. And I suspect the next step is going to be the texting and the apps and all the other military technology there is. We have a population that is captive, so we can do a lot of things to help them that we think is useful.
Let me take that another way, and I'm not quite sure if this is answering the question, but the other thing is that people can communicate with home from Iraq and Afghanistan in a way that they couldn't before. And that's a double-edged sword. There's been a number of those suicides that have happened after the fight with a wife, or the neighbor says, hey, bud, you know, there's been this Ford 150 pickup truck in your driveway at 4 in the morning the last few mornings. What's going on? So you can get information that you cannot act on because you can't just leave and go home because you're worried your wife's unfaithful. And so we're trying to learn how to shape that and do that better. But it is certainly new to this war that you're continually in contact with back home, or continually in contact, I should say, if you're in a mature base that has web. Other times you'll go back and you'll be in a FOB, forward operating base, that's outside the wire way away, and you may not be able to hear anything or see anything for a while.
Great.
Any web questions?
Oh, we got one more? Do we have time for one more? No? Okay. We'll okay, all right. Well, I got
Thank
the
you very
permission
much.
from Claire.
Thank you. Again, my name is Luis Cardona, and I'm with the Montgomery County Department of Health and Human Services. And I was really interested in terms of what you were talking about for the healing aspect of the individuals with PTSD. I've had the opportunity to mentor a lot of young men over the years, and 3 of them are veterans, having served in Iraq. One is a highly decorated sergeant stationed in Fort Benning. Another one is a lieutenant in the United States Marine Corps. Then there's another young man that kind of fit the profile what you were talking about earlier, and unfortunately, he was the byproduct of a lot of that trauma, the experience, and kind of self-medicating to cope with all that trauma. He's doing 12 years in prison for DWI charge now in the state of Maryland. And it was interesting because right before it was time for him to go in, I invited him to a process that I use as a healing process for many of the young people that I work with. they're called healing circles. And the interesting thing is the other young men that I talked about, I met them when they were teenagers, and they were teens. At the time, they were involved in gangs, but they were able to make that transition in life and leave gang life behind. And the military was what really helped them get to that point, right? But the interesting thing to me is I kind of talked to them about this young man that I just talked about, and I asked them, like, how did you cope with everything that you cope? Because they often come to me, you know, sharing their horror stories. And they said, those lessons that you taught me, those processes that you taught me, in particular what I learned in that sacred space of the healing circle, we did with some of the other troops amongst ourselves, in particular with Native Americans they knew. And so to this day, they tell me they still incorporate that. So it's a skill set that they developed, and it's helped them because all those symptoms you talked about, they experience them all the time. And when they do that, whether it's having a healing circle or a small circle at home with their wives and their children and processing that in a group setting, they said it's really powerful. Now, the other young man that I talked about, the one thing he said to me, and he still says to me, he writes to me and my wife, he says he wished he would have gotten those lessons or that kind of a coping mechanism, because perhaps he probably wouldn't resort to drinking, to dealing with what he was going through. So I'd be interested to know what your take is on that.
Yeah, there's so many things I could answer, and Bill's going to give me the hook, but let me highlight a piece, which is he's in the criminal justice system, and we're going to talk later about that. But people who are in the correctional facilities have a hard enough time reintegrating already. If they're veterans and in the criminal justice setting, it's even harder, and we don't have nearly enough at the moment to be able to reach out to those folks and do what we can. There's some model programs where you have both veteran courts to reduce them going in and some outreach to the facilities, but that's something I hope that the panel will tackle a little later on.
I want to thank our panelists, Dr. Ritchie and Dr. Hutchinson, for their work. Thank you.